Hello, Gina.
Hi, Bella.
How you doing?
Very well.
So you are a survivor. How many years now since you survived breast cancer?
Okay, so 7 years since I detected the lump and 5 years since I completed my active treatment.
So you battled it for 2 years, basically?
Yes.
7 years. How did you get to that point where a lump was detected?
So just like a lot of people today, I was not breast aware.
Okay.
I was not involved in any self-breast examination routine. And so I just felt a sharp pain in the right breast. And I think I ignored it for some time. I only touched the breast to see what was giving me pain when the pain persisted. Then I realized there was an unusual lump in there. It was unusual because when I touched the other breast, there was no lump and there was no pain.
And that's how you could tell that something was wrong?
Something was wrong.
So you immediately went to see, what, a doctor? Ideally,
that's what I was supposed to have done, but I didn't do that.
Why?
So typically, just like any other person that is as ignorant as I was, I resorted to self-medication. Yeah, so I had just weaned my son. So at that point, I thought it was like a post-weaning effect or something. That's what everybody was saying, actually. So I started doing the cabbage leaf. They asked me to put it on it.
You were putting cabbage leaves on your breast? Who told you that?
You know, everybody around you would tell you something.
Oh.
Once you tell them what you think it is. So I thought it was post-winning something. So everybody was giving me a solution here and there.
Cabbage?
Condo.
On your breast?
Yeah, just to get the lump disappear. But that wasn't working. So this started from October 2017.
Okay.
So by December, January 2018, I realized that no, the breast was looking deformed.
Okay.
And the pain was getting so unbearable that I could not even put on a bra. My productivity was getting lower because the pain was just unbearable. That was when I decided to report to a hospital.
And then what happened?
They did what they had to do.
Okay.
They did a clinical breast examination. And then because the lump was palpable, it was obvious that something was in there. Then they did the ultrasound scan of the breast. That was supposed to give them a confirmation that, yeah, it is suspicious of cancer or not.
What's ultrasound like?
So the ultrasound, you know, you go naked, and then they will use something like a machine
to run around your breast.
So the inner part of it will be seen on a PC.
But because you were in pain, when that machine was placed on you, did you feel more pain?
I felt more pain.
Okay.
I felt more pain.
Okay.
But you know, Bella, I'm thankful for that pain. But for that pain, I would have missed the lump. I would have actually missed the lump. I wouldn't know there was any lump there.
Exactly.
And I felt fortunate because early stage breast cancers aren't painful. For most people, they don't feel pain.
So you are lucky then because
Very
yours
lucky.
was still early stage, but you could
stage.
still feel the pain.
Yeah.
So when they discovered it was breast cancer, I can imagine the panic and all that.
Bella.
What happened?
It wasn't even discovered at that first meeting.
Okay.
So after the ultrasound scan, I was told it was a benign breast condition. It wasn't cancerous, so it was more of like a fibroadenoma. It's a benign, they said it was a benign breast condition.
But aren't they supposed to take out tissue to test before they can determine if it's benign or not?
That is what they were supposed to have done.
Exactly.
I also didn't know what they were supposed to have done. So after that meeting, he told me it wasn't cancer, but then I should go on an antibiotic and then keep observing the breast for further changes within 3 months. Should I see those changes, I should report immediately.
Okay.
And those changes he mentioned was discharge, change in color, texture, sore, and all that. And I realized that the scan was repeated like 4 times. And it made me felt he was suspecting something that the scan was not proving or confirming. I asked, but he told me not to worry. But then he's positive the antibiotic would take care of.
Was this a new doctor or something? Because I'm quite surprised.
It's a private hospital I went to.
Interesting.
And so for me, that was an awakening moment for me when he said I should look out for further changes. And his whole demeanor told me something was amiss. Yeah. So I went online. Then I Googled indication of lump in breast. Then breast cancer popped up. I'm like, really? You can imagine. Then I begin to have this kind of panic attack here and there. What if it's breast cancer? What if he missed it? What if, you know? So I sought a second opinion, sought a third opinion, sought a fourth opinion.
Second opinion, what did you hear?
I told him I suspect I have breast cancer. I've done ultrasound. They said it isn't, but if there are any further investigation beyond the ultrasound, I needed him to help me get those ones done so I could have my peace of mind. I wasn't looking forward for them to tell me it was breast cancer, but then I knew that even if it is breast cancer, the earlier, the better. Okay.
So you didn't think that's, oh, this is it, I'm going to die?
Well, at that point, I just wanted to know what was wrong with me.
So the second doctor you went to, did they confirm?
He told me I was 30 years. And the fact that it was painful, I could ignore it. It isn't. He was very certain it wasn't breast cancer.
After ultrasound or before? Did they even do ultrasound?
No, he didn't. I told him I had done ultrasound. And they said it was fibroadenoma.
And he didn't bother to do further checks or anything?
He just said, considering my age and the pain, the fact that the lump was a painful one, he was certain it wasn't cancerous.
You went for third opinion. What
then
did
he told me he's a gynae all right, but he doesn't do breast.
So why didn't he just, you know, refer you to another doctor?
So he actually, so it's a third doctor that asked me to go to a different facility. Oh. But when I got there too, they also didn't let me see the specialist. I had to pass through, they said the rejuvenative healthcare nurses. They also diagnosed me that it wasn't cancer. Then they mentioned some, they also gave me a different prescription. Bella, within that time, I was reading so much, and, you know, knowledge is something.
Yeah.
I was like, what if, do further investigation. Yeah. I didn't know what I could do at that moment. I was reading so much and was getting confused at a point. But I needed somebody who knew the technical know-how, or who had the technical know-how to let me know that, yeah, you've done all that was necessary and it isn't. Then I could have my peace of mind. So I insisted. They also gave me some antibiotics. I knew it wouldn't work. I knew with them that, so I didn't even take. So after 3 days, I came back. I begged them that even if I needed to pay to see the specialist, because I realized I was losing weight. Ooh. Within that short period that the awakening came that it could be breast cancer. I was just losing weight. I knew the breast cancer was just in its corner. It wasn't doing anything, but the fear, the anxiety, the confusion and all. So they let me see the doctor. He then asked me to do a complementary ultrasound and mammogram. Okay. Usually, if you are not 40,
they won't do a
mammogram is not advised, but
because I hear it's painful. They put your breast on something and then they press on it. So in that pain, your breast was pressed again. Yeah. You must have screamed.
I didn't scream though, but then it was painful. Ooh. It was painful. It was very painful. And the mammogram didn't pick anything, but the ultrasound this time was highly suspicious of cancer. But I needed to do further investigation. That's where the biopsy came in, where samples of the tumor would be picked to the pathologist to look into and then give their verdict. So that was done. Well, I was praying, hoping that it wouldn't be breast cancer anyway. So, yeah, the result came and it wasn't breast cancer.
Oh, thank God.
I was excited.
So it wasn't?
It wasn't. And then I knew that it was a biopsy that was going to give that conclusive verdict. So at that point, I was like, I could breathe now. God, thank you. But then the doctor said he would still need to take the lump out. The lump out. And so I was to go and then return like a week for him to have that procedure done. 3 days after I left him, he asked me to come back. He called that he's not so comfortable with the result.
Why?
And, he said his experience with the breast cancer features over the years. And then what my report is saying,
it didn't tally.
No.
Something was wrong.
Something was wrong, but he wanted a second opinion. This time he was asking for a second opinion.
Interesting.
And I also hesitated because that procedure is quite painful. Yeah. Very painful. I told him no. I mean, it is not breast cancer.
Exactly.
No.
Finally, you get, you know, the results.
He insisted that it was in my best interest. So I had it done, and then the samples were sent to a different facility this time. I still prayed, hoped. The result came. He counseled me, told me, yeah, it is breast cancer, but this time we have a lot of interventions. So provided I'm able to adhere to the treatment plans, I have a chance. And what gave me hope was that he said the kind of cancer I was diagnosed with then was a kind of cancer that could be survived, like 100%.
Oh, okay.
Chances of survival.
So there are even different types?
Different types.
Of them?
So this one was the DCI, so ductal carcinoma in situ.
Hey, you remember everything. It's not easy, eh?
It's not invasive. Then I was told it was not the invasive kind of breast cancer. So I had that high chances of survival. Yeah. And we started talking about, okay, so what would be the intervention? Then he said surgery, and then possible hormonal therapy. He didn't mention chemo then.
Okay.
So he said hormonal therapy, radiotherapy. I was like, no, all these things are like, you know.
It's a lot for you to take
A lot for me to take at that moment. I was like, I think I'm too young to get myself exposed to all of those things that he was saying. And so I would rather would do diet.
Okay. That was one of the options?
He didn't give me that option. I gave myself that option. That sounded more friendly. That I've been hearing of one guy be on radio that you could use diet to reverse a lot of these lifestyle diseases and chronic diseases. So I think that came to mind. I'm like, I would rather go and see that man to see if he would be able to help me use diet rather, because that sounded more friendly.
Anyway, hold on, Gina. We have a doctor in the house, so we're going to bring a doctor on board so she can also explain further. Gina seems to have done all the research. In fact, at this point, all she needs to do is just go to medical school and she'll be a complete doctor altogether. But let's also invite Dr. Hannah Lisa to also join us. Hello. Oh, give her music. She likes to dance.
I don't know if I like dancing.
Are you not going to dance for us?
Oh, better.
How are you doing?
I'm well.
I have a bone to pick with you doctors. Why did you make Gina suffer so much?
I mean, I was listening and I was like, doctors are always in trouble.
I know, but like to think, you know, how do doctors even give a verdict when they haven't taken some tissue out to check if really it is cancerous or not? That's my first question, because she says that her first doctor just did an ultrasound, and said, oh, it's nothing.
So thank you for putting me on the spot.
I had to.
But then the thing is, I can't speak to her particular situation because I don't know which doctor she met. I don't know the details of their encounter. But I would think that before a doctor makes a diagnosis, more often than not, we want to be sure, especially with something that is as life-changing as cancer.
But in her case, she was in severe pain. So there was a lump, she was in pain, which is what led her to the hospital. And so at that point, shouldn't the doctor have probably gone further?
Yeah, so that's the challenge here. It's a tricky one because we have a type of cancer that is inflammatory. It's very uncommon. And we also have mastitis, which is an infection of the breast, which presents the same way. So redness, pain, tenderness. Most of the time, breast cancer is not painful. And so if somebody presents with that, your first line of action would be, let me treat the infection of the breast.
Yeah.
And so that's where the challenge is sometimes, because the other type is not as common, and then the infection is more common. We won't jump to treat the less common one. So most people would rather treat the infection, and then with further investigation, they may pick up that it's a cancer.
So you say mostly breast cancer is painless. At what point does it present with pain?
Mostly the lump is painless.
Okay, so at what point do you start feeling the pain?
So that's a different kind of cancer. So that's the inflammatory type. That's the one that is quite painful, but that's very uncommon. But mostly the lump is painless. And so when you find a painful lump, it's highly possible that you'll be dealing with an infection, and that's what most doctors tend to treat.
So at what point do I realize I have breast? Not me, nobody, amen. But at what point do you realize that, okay, now I have breast cancer? What kind of changes do you see in your breast?
So I always say that you should know your breast. That's the most important thing. Like when I tap you, Bella, and I say, describe your breast to me. If you are sleeping at 2 a.m., you should be able to tell me the shape and size of your breast. 2 a.m.,
I'll fight you back. Why are you waking me up to describe my breast?
You should be able to tell me the shape and size of your breast.
Yeah.
Mostly one breast is bigger than the other. It's more common in the left. Mostly the left breast for people is slightly bigger. I mean, that's generally. But some people have their rights being bigger. So if you know this, then when you wake up and then you see that one breast is bigger, you're not very worried about it. Then the nipple, you ask yourself, is your nipple everted? So is it out? Is it flat? Or is it inverted? Mostly when it's inverted, there's a problem. But most people are either everted or flat. So let's say you have everted nipples. That means your nipples point out. And then you wake up one day and then it's pointing in. It should tell you that there's a problem. So you check your nipple. There should be no discharge. If every once in a while, you can have a little whitish discharge. It's not bloody. It doesn't smell. There's no odor. It's just a little like something like milky, but it's not that bad. And it's mostly associated with your menstrual cycle and the changes.
Are you abnormal if you've never experienced that?
No.
Okay.
For some people,
okay.
For some people, okay. Yes, that's what it is. But then if it's a lot and it's persistent, then you need to come for us to check it out. So these are some of the things you should know about yourself. Around the times you have these symptoms and signs, then you check the skin of your breast. Mostly the skin of your breast is very smooth. But you start to notice that there's certain redness around the skin. There's something like an ulceration or a rash. I'm not saying every rash is breast cancer, please.
Yeah.
Yes. Or you notice that there's puckering or what we call peau d'orange. Your skin becomes just like the peel of an orange.
Okay.
You know how the peel of an orange is? No, it's something to report. So I say that the most important thing, know your breast. As soon as there's a change, please let us know. Because some people, the lump is like the last thing they find out, and that's like later in the later stages. So as soon as there's a change, please let us know. And also the men and the partners, most of the time they have helped us diagnose breast cancer because of the lumps, because they can feel the changes. So please, I'm not encouraging very bad behavior, but then with your partner, you can do that for us and help us know when that changes.
If you're married, don't say Dr. Hannah Lisa says with your partner, so you must get a boyfriend at all costs, even when you are not of age. But Gina, let me come back to you. So what kind of treatment process did you go through? Did you actually go and see the guy to fix your diet for you?
No. I had a change of mind that very moment because the doctor was very patient with me. He showed me pictures of women who came. I mean, there was cancer in the breast, but you wouldn't know. And then when they left to pursue alternative treatment, they came back with highly ulcerated breast. So he showed me the pictures, and I said I would have the surgery. So what actually helped with my self-efficacy too was he told me I could have my breast conserved because the lump was around the 10 o'clock. The lump was around the 10 o'clock area of my breast.
What does that mean?
So not like around here. You see the wall clock. So 10 o'clock area here, almost around the armpit.
It was there.
It was there. That's where the lump was.
Okay.
It wasn't in the breast itself. So a lot goes into considering if they could have the breast conserved. So the lump was not that big, and if they were to take it, they were going to take margin of the breast, and what will be left will still look like breast.
Okay.
So I just qualified to have the breast conserved at that time. Nice. It was DCIS, as I said. It wasn't an invasive kind of cancer. So I mean, it was just in my favor to have the breast conserved, and that helped my self-efficacy. That after all, I'll treat the breast cancer, I'll still have my breast. Things didn't go as planned. I had a lumpectomy where the breast was conserved, and usually when the lump is removed, they will have to send it back to the pathologist. That was done. When the result came, there was an invasive component hidden that the biopsy didn't pick.
Okay.
So he now referred me to Kolebu. Unfortunately, it took 3 months before I was able to see an oncologist. So, I mean, you can't blame it. It's a system, the pressure.
There was a queue.
A queue.
And it took you 3 months?
Yeah.
God forbid, but if those 3 months, the breast cancer just, what do you call it, metastasized? Or what do you call it? Then that would have been, hey, share, exactly. That would have been the end of you.
So that was my fear. So within that 3 months, I mean, as I said, for me, I was just losing weight effortlessly.
You must have been happy. I mean, if you wanted to lose weight, maybe.
Weight loss from sickness.
I know, it's not exactly a good thing.
So the conserved breast within that period started discharging blood. So I got to see the oncologist. They also requested for ultrasound. And it wasn't breast cancer. It was breast duct ectasia. It was a benign, but then they insisted I would need chemotherapy. But, you know, the dreadful chemotherapy, what we all fear. And it wasn't something I was expecting, because all I knew was it was an early stage kind of breast cancer. Probably when you get to Kolebu, you only do radiotherapy and a hormonal therapy, you know. Chemotherapy was not. So I had no idea. All I knew was what I had heard outside. It could kill you, your hair will go, you will grow old, you know, your life will never be the same, all the bad stuff, negative stuff out there. I was terrified. I was extremely terrified, but, you know, I had the first surgery. I had chemo.
You had another surgery at Kolebu?
Yes.
So what again did they have to remove?
Now the whole breast was removed. After the chemotherapy, the discharge persisted.
So they've removed your breast?
Yes.
One?
Yeah. What I say? It's just packaging, you know, Bella.
What?
Yeah, I'm living with one breast.
Wow. I was hoping you wouldn't tell me that they had to remove the whole breast.
No, I had the whole breast.
And that was
removed.
after chemo?
After the chemo.
Doc, at what point does your breast have to be taken off completely?
Okay, so it depends on the size of the cancer, whether or not it has spread to other parts of the body. So if it's small, we'll have a lumpectomy, like what she said. So a lumpectomy is just removing the lump. So it means that it hasn't spread beyond its confined tissue. So we can just remove the lump. But doctors just want to be sure. So then we may do radiotherapy or chemotherapy. So that if there's just a little that has escaped somewhere, we kill it. Yes. Then there's the mastectomy. That's removing the breast. So the mastectomy, we have either we're removing one breast or we are removing both, depending on how far it has spread. And it may, so that's the surgery. It may go with either chemotherapy or radiotherapy. Chemotherapy is using drugs. The drugs can be IV drugs or pills or tablets to either kill some of the cells to reduce the size before surgery. That's neoadjuvant chemotherapy. Or kill some of the cells after surgery, which is the adjuvant therapy. So these are the options available. Radiotherapy is using radiation to kill. Then sometimes if it has spread to your lymph nodes, that's why sometimes when we're doing the exam, we check the armpits. The lymph nodes are there, and sometimes that's even where the breast cancer starts from. So then they can also remove the lymph nodes as well. Now there's an option of reconstruction. So that depends on how bad it is. Bella, if it has taken over the whole breast, they won't be able to reconstruct it because they are even hoping that there's none in other parts of the body. So it depends based on the surgeon's evaluation and then the oncologist reports. They'll be able to tell you if that option is available to you. Other than that, then we also have something that is not common in Africa, but it's common elsewhere, is the prophylactic mastectomy.
What's that?
So most of the time, you realize that somebody's grandmother died of breast cancer. The mother had breast cancer. Your sister has had breast cancer. I am not a prophet of doom. Who is next? It's you. So if you realize that you are next and you want to do something about it, you won't wait for a diagnosis of breast cancer to be made. You just go to the hospital and ask them, please, take out all my breast tissue. That one, when they take it out, people fix all sorts of things there.
So you become flat-chested?
Not flat-chested. So that is where there's a beautiful reconstruction for you. They've taken out all the tissue. They fixed it with other things, silicone, other things. So it's there. So you're walking around. Nobody knows that it's not your breast tissue that is in there.
So is it true then that silicone prevents breast cancer?
It doesn't prevent it. It's just, if you do prophylactic mastectomy, that means that you've taken out the tissue. So what is there, no breast cells can even, abnormally grow to become cancerous.
But what if, like you said, it starts in the lymph node?
So that's another thing. So I think that depending on how bad your family history is, they will decide whether they are taking away all the lymph nodes as well, or they are just doing just the breast tissue.
What's the work of the lymph node, first of all? So that if they are taking it out, I know that because they've taken it out, I'm probably not going to get...
So in this particular case, we are taking it out because the breast cancer can start from there. So we are taking it out so that we don't have any chance of a breast cancer at all.
I see. Did you opt for reconstruction?
No.
Did they give you those options?
Yes.
Oh, so they told you they could do it?
Yes.
Why didn't you do it? Is it the expense? Is it...
Not just the expense, but it's not a one-off procedure. I didn't see myself going to theater
over and over again. You were tired?
I was tired.
How did your husband take it?
He was very understanding.
He didn't mind that you had only one breast?
No. For him, once he was assured that that was going to guarantee my survival,
He was fine with it.
More often than not, the women are very willing. They are very willing to have the surgeries. When you tell them you have breast cancer, we need to do a mastectomy, we need to take it, they are very willing. But they go home and they come back and they say, my husband says no. Or my husband says he doesn't want a woman with one breast. And so most of the time, the resistance actually comes from the partners. So I'm very happy that her partner was very understanding.
Yeah.
Because no woman will want to die. Like you've been told, take off your breast so you can live.
Yeah.
Most of the time, the problem comes from the men. They would say no. And so that's what leads the women to prayer camps and alternative sources, and most of the women die. So most of the women we've lost, it's mostly as a result of resistance from their partner.
She said something about dieting and how that could change or reverse, you know, the cancer. Is that true? Is it possible? Because I've heard that if you take a lot of carrots, so I know someone who was doing a lot of carrots, a lot of that green thing that they put in palm nut soup. Abedro is what they call it. I don't know the English name for that one.
Berry.
Techie berry, yes, that. And a couple of other things. And I'm told that that can also reverse cancer. So people really rely on that. Is it true?
Bella, I'd not like to speak to alternate medicine or to diet because that's not my specialty.
Okay.
But based on the research, we know that cancer, especially breast cancer, after a certain age, there's nothing that can be done about it. That's why the cells that are abnormally growing have to be taken out.
Okay.
These things can help you. Maybe they say that because a risk factor of breast cancer is obesity. So you're not eating well, you're not exercising, alcohol, and then smoking. So we also advise dietary modification and lifestyle modification.
If you're not exercising, you're...
Yes, because you become obese, and that's a risk factor.
What if you're not exercising, but you two, you are not becoming obese?
Well...
Sedentary lifestyle is also a risk factor.
Yes, so
sedentary lifestyle.
That's not. Hey, that's not moving.
God. Okay.
It's hitting
I'm asking
hard,
for myself because actually, the exercise, it's exercising me.
Yeah, it's hitting hard. But you see, I think maybe that's it. Because even when we are treating you for cancer, we would ask you to reduce the risk factors. There are some risk factors you can do something about, but some you can't do anything. Like you're a woman, there's nothing you can do. Age, you are growing, there's nothing you can do. So maybe that's why people think that it can do something about it. No, reducing the risk factor is reducing your chance of having it. It doesn't mean that when you have it, then it can cure it. Yes. So
that's scary. I'm sure you're watching now and thinking, do I have anything? Do I not have anything? You should get screened. It's important. Very, very. Don't even miss out on that. And so if that's the case. I guess that's how you eventually became an advocate for breast cancer awareness.
Yes, so for me, when I was having my chemotherapy at the radiotherapy center of Kolebu, I looked out for a survivor to just draw inspiration from. I didn't get any. You get to the center, it's like everybody is minding their business. Then, now it's more relaxed. Yeah. They are just so you don't get to meet only breast cancer patients. We have all kind of cancers, so you wouldn't even know who is there for breast cancer. And it's quite scary because you could see somebody with the eye swollen and you are thinking, did the cancer move from the breast to the eye, you know? And I didn't get any. So I told myself, should God grant me the grace to survive, I'll be that person I looked for that I didn't find. Yeah. So when I had to go back to the theater, once I was out, I told my surgeon I was going to come back, not as a patient, but as a partner. Yeah. So I started volunteering at the breast clinic since 2019. Nice. Then the Breast Society of Ghana took it up and formalized it. So now it's more like I do patient navigation. So every clinic, I work with the breast care team. So because of that, I had to go back to school to study counseling to equip myself to be able to help better. That's nice. Yeah. That's really impressive. Well, so Doc, what would be your final words to everyone who's watching now? Yes, she mentioned something about not seeing enough advocates. It's because of the stigma. So my first words goes to society. Please, there's nothing really, it can happen to anybody. There's nothing to stigmatize somebody about if the person has breast cancer or there's breast cancer in the family. Because of that, people can't speak up. So a lot of people still believe that there really is no breast cancer because you're not seeing anybody with it and nobody is speaking up. Even her that somebody will be like, oh, maybe they've paid her to come and say something. And mostly that's what happens, yes. So that's please, society, yes. I get to hear that. So society, please, there's nothing to stigmatize. Now the family and friends, you need to be supportive
all through the journey. The most difficult time is not just when the diagnosis is made, but it's also when the person has to now accept it and decide that I am going to go for these treatment options. Now, even choosing a treatment option is not easy. Chemotherapy with all the side effects she was talking about, the person is going through physical pain, but the person needs a lot of emotional support. And so we need to do that as well. Yeah. And then the doctors like me who want to come out and talk on TV too, please, I encourage more of you to come out and talk as well.
Definitely, and get screened is important.
Yes, very important.
It's Pink October, and so please get screened. And when you are diagnosed with cancer, it's not a death warrant, right?
No, it's not a death sentence.
Sentence, more like, okay, yes, thanks for correcting
Bella,
me.
It becomes a death sentence if you go to the wrong place for the wrong treatment.
Wrong place being where? The church?
Yes. Any other place.
Well, I mean, take your doctor's advice seriously, because we need you alive, we need you healthy. So you can also become an advocate, like my doctor here and like Gina, who is a breast cancer survivor. Thank you so much for sharing your story. It's incredible, and I hope that a lot more people hear the story of yours. Just before we go, I mean, I still want to see what it's like to have a silicone breast. For those of you who are probably sitting home doubting and thinking that she's been paid to come and tell the story. Gina, again, are you comfortable?
I am.
Can I see what a silicone breast looks like?
Okay. Okay, so this is it. This is a lawyer. Most of us have
so that place is flat?
It's flat.
Can I touch?
Yeah.
You don't mind?
I don't mind. If you are not scared. Oh, no. See?
Wow.
So there's no breast here.
Meanwhile, this is breast.
Yeah.
Okay. This is my first time actually feeling it. I've seen people talk about it, but wow. So you can't wear a bikini and all those things, right? Because it's gonna. Oh, you can.
You can.
Are there special bras for these things?
Yes, we have special bras.
Interesting.
We have special bras.
The first time you fit it in there, how did you feel?
Okay. Maybe I'm somebody, like, I easily accepted the condition. For me, once I'm alive, because I've seen people die along the way. So for me, life was more important to me than anything. And then losing my breast was just an aspect, like just a minute part of my body.
You know, those of us who like cleavage and things, like now you can't really do all those things. So you're thinking,
so you could have the breast reconstructed if medically it's okay.
Would you eventually do that?
No.
You don't intend
I want it to remain like, because of what I do. Because often when I go to the clinic and advocating or encouraging them,
you need to.
They say I don't look like it.
Why? What are you supposed to look like if you've survived?
People have this perception that you should be looking sick, frail. Yeah. You should look like cancer. Like your hair should be gone.
Did you lose your hair?
I lost my hair.
But you're back now?
Yeah.
You're okay.
Should I take the wig off?
You want to take the wig too off?
I don't mind.
Oh, no, it's okay. You say your hair is back. So you're fine. You have cornrows.
I have my cornrow.
Okay.
It's all back.
No, please don't undress here. We beg you.